Yeah, there's no basis in science for the vaccine mandates. Everybody needs to understand that. This is a political agenda, not a science agenda. This is not a public health measure. You've got people who are committed to this whole construct of centralized public health and control at a global level. You can call them the globalists, or I prefer to use the term centralists, people who dream of a world where everybody is on the same digital ID with their vaccination records contained in that digital ID and prohibited from doing all sorts of things if they aren't keeping their vaccine status up to date and maybe their social credit score.
Hello, my name is Donald, and welcome to the #1 media company, WorldView. At WorldView, we explore everyone's perspectives on all things that can broaden our worldview. Today, we're talking with Nick Hudson. Nick is an actuary and a co-founder of PANDA. PANDA is an organization founded in the wake of COVID and seeks to develop science-based explanations and test them against international data. Nick, good morning to you. Welcome to the show.
Good morning, Donald, and good morning to your viewers.
So, Nick, we're going to ask some controversial questions. So, can you give us some background? Why can you answer these questions?
Well, the organization PANDA is now a very large international organization with members in over 30 countries. And we cover the whole range of disciplines that would be necessary to understand this very complex phenomenon that has been the COVID policy response. And we've been at it from the very beginning. We've published a hell of a lot and done numerous interviews, podcasts, webinars. It's been nonstop since April of 2020. And that multidisciplinary approach is the hallmark of PANDA. It's what enables us to see these complex social and scientific problems from multiple aspects. So you get a perspective that isn't the kind of knee-jerk, narrow, balkanized perspective that a lot of the establishment scientists are working from.
Okay, that's interesting. So first question, Nick, is there any evidence that the lockdowns have been beneficial, or is it been a dumb idea from the start?
No, it's definitely in the category of dumb ideas from the start. There's no evidence that the lockdowns have been beneficial. There's quite a bit of evidence that they have had no effect to a worsening effect. And the really astonishing thing about that is lockdown as a concept is new. What the pandemic respiratory virus guidelines prior to February 2020 all said was that quarantining of the healthy, which is the term they used for lockdown or lockdown-like responses, should never be attempted. They mainly motivated that exclusion principle on the basis of the collateral damage. But if you go to very basic first-year epidemiology and you look at what is expected in the face of a very age-graduated pandemic like COVID, then you expect that if you lock down, you will cause the disease burden to shift onto the vulnerable people and overall mortality to be worse. So just think about all of that, okay? You've got guidelines all over the world, including the World Health Organization's own guidelines, which had been updated in 2019, advising against lockdowns. You've got basic epidemiological models telling you that in the face of an age-graduated disease, lockdown will worsen the outcome. It's never been attempted. There's never been any evidence, statistical evidence of any quality to demonstrate a beneficial effect. And yet here we are. 2 years later, countries are still locking down.
And correct me if I'm wrong, but I believe vitamin D is one of the best counters against COVID. So we should be out in the open, not locked in our homes.
Yes, I mean, it's well known that vitamin D has an important role in maintaining a healthy immune system. The size of the benefit from supplementing with vitamin D, in tablet form is a somewhat contentious issue. But it's a very brave person to deny that there is a benefit, that I would brave or foolish. And certainly sun exposure is a very effective way of improving your serum levels of vitamin D, and locking people up inside, telling them to stay away from other people. All of these things are bad. They were terrible public health principles.
But Nick, in South Africa, we didn't just have a typical lockdown that you find in Europe or America. We had a lockdown in terms of the restriction of the selling of alcohol and cigarettes. So is there any evidence that that was a smart idea?
No evidence whatsoever. I mean, the main motivation there was supposedly to reduce the burden on ICUs, but that was a bogus idea, because if you look at the actual burden placed on ICUs by alcohol-related incidents, it's very small. And so even if you eliminated those, which you were never going to do with an alcohol ban, because people carry on, consuming out of their stocks, and they managed to circumvent the ban very, very creatively. So all it did was threaten the jobs of hundreds of thousands of people. And it came from a faction inside the SAMRC, the South African Medical Research Council. There are these two rabid anti-alcohol crusaders there who pervert the science at every available opportunity. I mean, we've gone through some of their papers, and they are a disgrace. And they pushed this thing very hard, and it got governments and the National Coronavirus Command Council to launch those alcohol bans. But they had no more basis, in fact, than the hot chicken ban or the open-toed shoe ban. This was all just part of the insanity that has descended upon us as these nutcases have gone about responding to what is at worst.
Yeah, and you've been proved right by the fact that there's no alcohol bans anymore. There's almost no lockdowns anymore. So obviously they don't agree with the idea anymore.
Yeah, and this is true for almost all the interventions, whether it's imposition of mask mandates or lifting of mask mandates, or locking down or releasing a lockdown, or imposing an alcohol ban, or, all of these policy responses. You can see nothing in the data. There is no response detectable. If you gave a qualified statistician or data scientist the information and asked them to say, to tell you based on a case or death curve where a country locked down or released its lockdown or implemented a mask mandate, they would not be able to detect it. It's not possible. They're not, and it doesn't just work with respect to single curves. Even when you consider other countries, if you do a inter-country comparison, looking at whether countries that impose these things have better experience than the ones that don't, you get no signal whatsoever. Nothing.
Yeah, that's interesting. So, Nick, many of the people that have mainly pushed these lockdowns and said that we should be wearing masks are the World Health Organization and the CDC. And
yes.
is there every? I mean, these companies, these organizations are powerful. I mean, if you go against them on social media, it's likely that you will be deplatformed. So, can you give us some evidence of how these organizations have been wrong?
Yeah, I mean, they've been wrong in almost every regard. Let's start with the World Health Organization. I mean, their initial move was to claim that there was no evidence of human-to-human transmission. Okay, good start. Then their next story was to say that the Chinese response had been incredibly effective. There was never, ever any evidence to support the idea that lockdown solved any problems in China, none. And Bruce Aylward went on a short visit to China, turned around, and without providing any kind of study or analysis, praised the Chinese response, and that was the basis upon which other countries around the world went and locked down. Now, technically speaking, the World Health Organization claims it's never promoted lockdown as an idea, but that we know to be false. They have done it in private letters. We've got copies of some of those, and they've been very fulsome in their praise of countries that undertook draconian measures. So they're being incredibly dishonest in this way. But there are other notions that they have helped promote, such as the notion of asymptomatic transmission being a driver of the epidemic of disease. That's false. And the idea that mask mandates ought to be followed, even contradicts their own website, where they correctly maintain that there is no high quality evidence in support of mask mandates or the protection, any level of protection given by masks in the case of respiratory viral epidemics. And they've also maintained a really asinine perspective on the mode of transmission called the droplet and fomite theory. Now, fomites are surface contact, particles of virus on hard surfaces, shopping trolley handles and the restaurant tables and so on. There is no theory for how that form of transmission would even work. And there is zero evidence that any transmission at all, and when I say zero, I mean around zero, that any transmission at all arises out of droplet and fomite transmission. There's weak evidence for aerosol transmission, which I think is probably the likely story. And that's completely different, because aerosols are very, very tiny droplets that sail straight through a mask and that hang around in the air. So they will fill a space. And if a person, walks into a room who's ill and emits a lot of viral aerosols, that'll be in the space for hours afterwards. So all of these rules that stemmed from the droplet and fomite transmission theory, including the social distancing, the 6 feet rule and the 2 meter rule, the sanitizing, the elbow bumping, and the perspex shields in restaurants and the stickers on the floor and all of that stuff is completely and utterly bananas. And they're still doing it after 2 years with absolutely zero basis in science whatsoever.
Yeah, it's incredible. The other day I went to the American embassy and they had these strict rules inside, but outside everyone was bunched up. So I just don't understand it sometimes. But they're also, these organizations, they're also very hostile against anything other than the vaccine, if I'm not mistaken, as a solution to COVID.
Yeah, that hostility is there for a reason. You see, emergency use authorization for the vaccines is only granted on the basis that there are no successful treatments. And COVID is an extremely treatable disease. Peter McCullough, who's a very acclaimed doctor in the United States, is of the opinion that as much as 85% of deaths could have been avoided by adopting basic early treatment principles. And I agree with him, having looked at the data and also just considering the broader picture of what has been done to people. The standard of care is mainly entailed telling people to go home, and if they can't breathe anymore, to come to hospital. And that's the worst thing you can do in a viral epidemic, is collect all the sick people together in a place where there are other sick people already, hospitals and nursing homes. Almost all of the transmission that's resulted in deaths has occurred in what are called nosocomial settings, with households coming in third place after hospitals and nursing homes. So yeah, it's been a global situation of consistent and persistent medical malpractice that has caused most of the deaths in COVID.
Is there any evidence that oxygen tanks are good against COVID? Well, do you know?
Yeah. I mean, I haven't actually seen any data on that, but it's from clinical reports and the opinions of doctors for people who get advanced COVID. I have, a lot of people seem to think that this is beneficial, but I wouldn't go and make that claim as a very strong claim, simply because I haven't read any papers or statistical analyses of patients with and without oxygen. I would imagine there aren't any, because it's kind of difficult to withhold oxygen from a severely ill person would be, quite a tough one. So it's possibly the case that such studies wouldn't have passed an ethics board. But I imagine there's probably an advantage to it.
So Nick, now we're moving into a potential vaccine mandate. It doesn't seem like it's going to appear, but I mean, the idea was there. But before we move completely to that, if one has the vaccine, can one transmit the virus?
Yes, of course. And it's one of the most fascinating things was that you had the CEO of Pfizer, Dr. Fauci, the head of the National Institutes of Health, the Walensky, the head of the CDC, any number of these crackpot scientists claiming that the vaccines were going to put an end to the epidemic, that they would stop the spread. But there's no mechanism of action in this type of injection to prevent spread or to prevent infection. So, what happens is when you inject a vaccine instead of administering it as a nasal spray, you never stimulate the local nasopharynx response called the resident memory T cell response. And that is the response, this local response in your upper respiratory tract that gives rise to what is known as sterilizing immunity, which is immunity from infection. So that's why people who've had COVID for a period of a couple of years will not be infectable for the most part. So reinfection with once you've recovered from COVID is rare. It's extremely uncommon. And reinfection with severe disease is yet rarer. It's very, 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 very scarce. And so the reason for that is that if you're infected by the natural mechanism through your upper respiratory tract, you develop that resident memory T cell response that is able to protect you for a number of years from infection. There's no mechanism in vaccination using these vaccines that does that. And for that reason, it's actually contentious that they call them vaccines at all.
Okay, but on that note, why do they call it a vaccine? How is this possible? Because a lot of people, I believe, are pushing for a vaccine mandate just because of that psychological element of it's called a vaccine. A lot of people think, okay, if everyone just got this, problem solved. So how is it possible that this thing is called a vaccine?
Well, they had to change the definition of a vaccine in order to call it a vaccine. And the interesting thing is that the product you mentioned just now, vitamin D from sunlight and tablets, would also, arguably qualify as a vaccine under these new definitions, because they've just removed this idea that a vaccine is something that gives you immunity to infection and stops transmission. Those concepts have gone. The amount of redefining that has happened, everything from the basic concept of a case, they now describe a perfectly healthy person who's had a positive test on these completely overblown and ridiculous PCR tests that should never have been used to diagnose disease, probably even not infectiousness. That was a very bad move, because it was totally tied up with the creation of the mass hysteria that we've witnessed, is this constant reporting of cases. So there's been no problem. We've seen other things being redefined, such as herd immunity. The World Health Organization tried to change the definition of herd immunity from being something that you got predominantly from there being sufficient recovered people. They deleted the notion of natural immunity and made it only the vaccine that gives you a contribution to herd immunity. And that was ridiculous for the same reason that we discussed just now. These vaccines don't prevent transmission and infection. So they contribute very, very little to herd immunity. The most of the contribution, and I'm talking about like 99.9% of the contribution towards herd immunity, is coming from recovered people. The vaccines don't contribute to that. So the move that they made was actually doubly false in trying to redefine herd immunity. And they actually reversed the change after there was some outcry for and completely understandable reasons. But it just shows you how captured that organization is.
Captured by who?
By the pharmaceutical lobby, the vaccine stakeholders. Bill Gates is the second largest funder of the World Health Organization. Bill Gates is the largest individual investor in vaccines. And there's no question that this whole story was driving towards not just vaccines, but vaccine mandates and vaccine passports and digital IDs, and linking your IDs to your vaccine status, and down the line to, as we, I used to hesitate before talking about this, but it's now so much in the public domain that I think it's pretty open season. Even linking currencies, central bank digital currencies, to your health status. These are the ideas that these lunatics are discussing in Davos and in Geneva. And these are the people we have to stop at all costs.
Yeah, just before we follow this thread of thought, for our viewers who might not be so clued up about these terms, what is herd immunity?
The herd immunity is a construct that says, okay, so if you've got enough people who have generated that sterilizing immunity by virtue of having been infected and recovered, then the virus finds it hard to find new people to infect because you've got sufficient number of recovered people in the community, and that eventually causes the transmission mechanisms to break down, and you get a tailing off of the epidemic. It doesn't disappear. That's not the concept. Many people think that they misinterpret herd immunity as being some kind of mythical state where the virus will be completely eliminated. That's false. All that happens is the virus goes into what's known as an endemic phase, where the circulation is constant but at a low level. And we had partial herd immunity before the epidemic even started, because there are a number of broadly circulating coronaviruses that are closely related to SARS-CoV-2, the virus that sometimes causes COVID. And though that immunity protected, up to 80% or more of almost every population in the world. So we were well on our way to herd immunity before COVID even arrived. And what's happened now is, of course, the majority of most populations have been infected and recovered. The mortality rate of this virus is low, about 0.15% for the global population. For under 70s, it's about 0.05%. And for healthy under 70s, it's less than 0.01%. So it's not a dangerous condition for the vast majority of human beings. And the reason for that is that there was people with healthy immune systems who'd been exposed to a variety of coronaviruses through their lives, or young people who had very strong innate immune systems had immunity to this virus from the get-go.
Okay, that's interesting. I guess back to the vaccine mandates, because a lot of people don't understand this. Why is it then being pushed? I mean, if you can still transmit the virus, why do people push the vaccine mandate?
Yeah, there's no basis in science for the vaccine mandates. Everybody needs to understand that. This is a political agenda, not a science agenda. This is not a public health measure. You've got people who are committed to this whole construct of centralized public health and control at a global level. You can call them the globalists, or I prefer to use the term centralists, people who dream of a world where everybody is on the same digital ID with their vaccination records contained in that digital ID, and prohibited from doing all sorts of things if they aren't keeping their vaccine status up to date and maybe their social credit score. This has been had trial runs in China, and it's the direction of travel. These organizations like the Bill and Melinda Gates Foundation, the World Bank, they're all in on this trajectory of moving towards control at a global level of individuals and their freedom of movement, expression, and bodily integrity. So there's a kind of, some people refer to it as an ideological trajectory. I don't see it as ideology. I see it as political agenda. There are people in the world who believe that centralization is the way to go. I believe that's absurd. There is no fact in political science that has been more demonstrably refuted more times than this idea that centralization can ever have positive benefits for humanity. It's a dreadful idea, and one that we all need to wake up to and work against.
Again, just to play devil's advocate, I definitely agree with you, but to play devil's advocate, there's probably an argument that they would make is that there's a lot of people in Africa that don't get vaccines that might be very helpful to them. Not perhaps the vaccine for COVID, but perhaps other vaccines. So if we do this, we might get them to get those vaccines, and it will help them.
Yeah, there is kind of like this cult-like belief that the vaccines are the panacea for public health problems. It's ridiculous. The problems that people face in Africa are many, and what's happened is they've kind of zeroed in on pathogens, and this idea which I refer to as pandemicity, the idea that there are going to be more and more frequent pandemics. That idea is false. The globalization and integration of the world leads to greater resistance to the outbreak of epidemics because we're basically sharing all the time the broadly circulating pathogens. Viruses have had plenty of time, billions of years, to occupy almost every niche in the planetary ecology. So this idea that they're going to be these completely novel viruses that are going to spring forth and cause everybody to start dying in large numbers is a flawed one. But that's part of the cult, the cult that places pathogens in this almost godlike kind of status, and vaccines as the holy grail of defending against pathogens. These people deny the existence of immune systems and the importance of general population well-being. They would rather shut down the world's economy than in the effort to get these vaccines into every arm on the planet. Totally ignoring the huge public health ramifications of doing so, which would be much, much greater than the total disease burden of all the pathogens that we know about in the world. Communicable diseases are a problem in poor countries, but they aren't a problem in rich countries. And the reason they're not a problem in rich countries is the level of well-being is higher. And so shutting down economies makes no sense. It puts more people in the position of being vulnerable to communicable diseases because they don't have access to clean water and their economies are permanently on their knees. So you can forget about these people having an ounce of philanthropic goodwill towards humanity. They are bananas and they need to be seen that way. Gates, Fauci, Daszak, Barrick, all the gods of this story, Tedros, these people are simply nuts.
Most people now believe that the virus came from a lab in Wuhan. Do you think there's any possibility that this virus was deliberately created to be or deliberately unleashed on the world?
Yeah, there is definitely a possibility. I would say even a probability at this stage, but it's one that I kind of don't jump on the thing and go completely mad about it, because there is still a chance that this thing is something that evolved and indeed could have been something that had been circulating for a longer time than we know. So the idea that it emerged out of Wuhan in December 2019, I believe, has zero probability of being correct. That is not the case. This thing was definitely around before that. And, I think what's kind of lost, people get too excitable about this whole genealogical analysis of viruses. Viruses are not these things that organize themselves into neat taxonomic categories. There's a kind of continuum, a spectrum of, you can speak about clusters of viruses that share similar properties. And so I think people tend to try and squash viruses into species and subspecies in the same way that we would maybe look at birds. Even the effort to put any kind of organism into a taxonomic structure is difficult, but with viruses, it's particularly difficult. And I think it leads to some very bad ways of thinking about the problems. So I would probably, if I had to place money on it on even odds, I would go with there having been at least lab passage, not necessarily a lab, a deliberate lab creation or lab leak, but at least some time spent in a lab. And but I would, it would be that's kind of a strong hypothesis weakly held. If contradicting evidence came to light, I would change my mind.
Yeah, it's just strange to me that these virus testings were done in China, sponsored by the American government. I mean, it's a very strange thing to do.
Yeah, and you can see there's this history of academic papers where these guys are monkeying around with the spike protein in gain of function type work, and it's the same characters who are promoting the whole COVID policy response, the malarkey, as I like to refer to it, the craziness. It's the same scientists. It's, you know, to an extent, you can see it in the Fauci emails where, you know, the smoking guns are there. Fauci gets told by his scientists, look, this thing looks like it has a lab origin. And then he acts very quickly to cover up that story and to get the fact checkers, who are these people who are actually fact deniers. When you see somebody claiming to be a fact checker, you need to know they are there to maintain a propaganda narrative, not to correct false statements. And the fact checkers get launched on anybody who's talking about a lab leak or lab origin. So Fauci, who had funded through EcoHealth Alliance the gain of function work in China, was desperate to cover the story up. He didn't want to be the one who'd been blamed for the release of a deadly pathogen, as they thought it was, on the world, you know, responsible for a global pandemic. So he covered it up. Man's a criminal. Let's not mince our words here.
So, Nick, a lot of people who are pushing a vaccine mandate like to say, I think it also Melania Verwoerd said this, that if we get the vaccine mandate, it will be back to normal, life back to normal. But yeah, I mean, we see in Portugal, we see in Gibraltar, where they have like a 90% vaccination rate. Life is not back to normal for them. So is that something that will happen?
Definitely not, especially now, you know, it's blamed on Omicron, but I think it could be fundamental to the vaccines. What we're seeing is what's known as negative efficacy. People who've been vaccinated are more likely to be infected by Omicron.
Really?
Yes, this has come out of a study, quite a large and substantial study out of Denmark in recent days. And if you look at what's happening with Omicron. Okay, so the first thing to understand is these vaccines, the mRNA vaccines, like the Pfizer vaccine, which is the one that's being administered to the general population in South Africa, and the Johnson & Johnson type vaccine, which are known as adenovirus vector vaccines. Both of those types of vaccines work on a tiny portion of the virus called the spike protein. So they only teach your body to recognize a mimic of the original spike protein portion. It's this tiny portion, 6 or 7%, I think, is the portion of the whole virus. Okay, so I just want to say that again. The vaccines are teaching your body to to recognize a mimic of the original SARS-CoV-2. And what's happened with Omicron is all of the mutations, well, not all of them, but almost all of them, are on the spike protein. And that is a sign of one of two things: either further lab tinkering or evolutionary pressure being exerted by the vaccines upon the virus. If you do any kind of response that you take, whether it's lockdown or any kind of medical intervention or any kind of immunization program, will place evolutionary pressure on the pathogen that you're trying to protect against. Any type of action. That's a truism of evolutionary theory. So when you go and vaccinate vast proportions of the population with this very narrow vaccine-induced immunity, you put evolutionary pressure on that part of the virus. So this is a predicted result, that you would end up with variants flourishing that evade the vaccines. And that's what's going on here, is that it's actually complicated by another problem, which is that because of their kind of very brute force nature, they cause the immune system to overreact and to produce a very narrow and exaggerated kind of response to that very small segment of the mimic of the pathogen. And there's a fairly substantial body of science showing that inhibits the body from producing a broader natural response when a vaccinated person is infected. So if that's true, and if that's a very strong kind of observation, then what vaccinated people can expect is that they'll get reinfected more often than a naturally immune person who hasn't been vaccinated will.
Wow, that's fascinating. And correct me if I'm wrong, But isn't it also unnatural to push a vaccine so early on people? It shouldn't go like through a
Yes.
10-year cycle of testing.
It's a very bad idea. Sorry to interrupt you. Yes, for two reasons. First of all, it's a bad idea to vaccinate in the middle of a pandemic because of this evolutionary pressure that you place on the pathogen. And yes, they rushed this thing. They say, oh, but the platform had been developed for decades beforehand and so on and so forth. Nonsense. They skipped so many processes. It's unreal. They didn't do basic biodistribution studies, which is to say, where does the vaccine go in your body and what does it do when it gets there? Where are the pharmacological studies, pharmacokinetics and pharmacodynamics studies that look at the detailed action of the virus inside of the vaccine inside your body? It's important to understand the way these mRNA vaccines work is they insert messenger RNA into your cells in a process known as transfection. And they then cause your cell to start producing that spike protein mimic. And your cells will present that spike protein on their membranes. Your body recognizes that spike protein as something foreign and destroys those cells. So if these vaccines are transfecting in some vulnerable organ, the heart, the pancreas, the endometrium, the endothelial lining, something fragile, and if they're transfecting in large numbers in those organs, your body is going to start destroying the cells of those organs. And they can't answer these basic questions because they did not do the studies. They initially said that the vaccine product would be confined to the deltoid muscle, the shoulder muscle where you get injected. But the very first study that was done of the distribution of the so-called lipid nanoparticles from after vaccination found that they spread around the entire body. So they were wrong. They didn't. That is the proof that they skipped processes and rushed processes. There's no question.
So, Nick, what would your answer be to COVID? What should a person do? Is it ivermectin? Is it some other medical drug? What should a person do against COVID?
Yeah. So, well, the first thing to understand is even before the advent of this very mild variant called Omicron, we need to first take stock of the fact that the risk from COVID is very, very age graduated. For healthy young people, this is not a risk to worry about. So even early treatment there, I wouldn't even talk about that. You just want to stay basically healthy. Make sure that you're not deficient, that you don't have a bad diet. That's enough. But for vulnerable people, what you would do is early treatment. I think that the main evidence for the effectiveness of hydroxychloroquine and ivermectin is in the underhanded reaction by the pharmaceutical company lobbies to try and suppress them. That suggests to me that they know that they work. Okay, so we don't wait for randomized control trials, just look at their behavior. What they did was they started trying to pretend that ivermectin was a veterinary medicine, horse-based, and they put pressure on scientists to make adverse findings against ivermectin. In the case of hydroxychloroquine, they even sponsored trials where they deliberately overdosed the patients so it would make it look as if the patients were dying. They were murdering the people in the trials by using 10 times overdoses and more. And these were sponsored by the same organizations that own the vaccines. So there is, I believe, prima facie evidence for murder trials in those supposed trials. They were done by completely sham organizations as well. That were set up deliberately to smear these off-label drugs that are cheap and that make no money for pharmaceutical companies, and that would undermine the emergency use authorizations. All of this is completely verifiable. I'm not making any of this up. You can go and read about it. If you won't read about it in the mainstream media, but it's all completely reliable and documented. I would never say any of this if it wasn't true, because I'd get sued from here to kingdom come. So yes, I would take the approach of if you're in a vulnerable category and you don't get over the disease in 6 to 8 days, you then start early treatment to manage the inflammatory stage of the condition. And I believe that that's the most important intervention. It's when people go on to 12 and 14 days with this surging inflammation, and then they find that they can't breathe properly, and then they go to hospital. That's very difficult then. By then the complications are, through the roof, and it's difficult to treat. And you're in a hospital. That's the worst thing. The worst place you want to be during a viral epidemic, both from the point of view of the other patients and the doctors and the healthcare system and you. You want to try and be staying at home and managing a readily manageable inflammatory stage. And this has been known for a long time, but the vast majority of medical professionals are in complete denial about this. So yeah, it's basic health, vitamin D, zinc, quercetin. These off-label drugs, I suspect, will, in the fullness of time, be conclusively shown to be effective, but there is some work to be done still. And staying healthy, eating sensibly, not eating too many carbohydrates, getting plenty of sun, getting exercise. Those are the things you normally do. This is all common sense, isn't it?
Yeah, no, definitely. But correct me if I'm wrong, but a drug like Ivermectin has been around for quite a while, and it's generally very safe. It's
one of the most widely prescribed drugs in humans worldwide. It just won the inventor, or the discoverer, I should say, a Nobel Prize. It's used to cure a very horrible disease in Central Africa called river blindness. It is a great humanitarian agent. And so billions of doses have been administered in human populations, and the rate of side effects is extremely, extremely low. It's very safe, known safety and efficacy in quite a wide variety of parasitic and other diseases. And the mechanism of action of ivermectin in the case of COVID is known. They said there are more than one mechanism. And the really scandalous thing is now you've got ivermectin and Pfizermectin, the two drugs which are using the same mechanism of action as ivermectin, and suddenly all the World Health Organizations and the various authorities in South Africa and in the United States are, oh yes, now we must approve that, and everybody must use that because it comes from the pharma lobby. But when you look at the performance of those drugs in serum, which is to say, like in a petri dish kind of setting, it's not as effective as ivermectin. So you really can't make it up. The extent to which public health has been corrupted by big pharma and vaccine stakeholders it's pretty much exhaustive. There are no agencies who do not take substantial funding from these organizations, and it's in all cases funding which they cannot afford to lose. So they dare not put a foot wrong and contradict this cult. That's the pattern of it.
Yeah, that's just shocking that a company would want to profit from a pandemic.
Nothing new under the sun, I'm afraid, Donald.
But Nick, I see our time is running out. One last question I want to ask you is masks. Is there any evidence that wearing a mask is beneficial, that it will help reduce the spread of COVID?
The biggest meta-analysis of mask efficacy studies was done by the European CDC. And their study concluded that, with one exception, one paper out of hundreds, all of the evidence on masks, positive and negative, was of low quality, and almost all of it exhibited strong signs of bias. Mask mandate science is junk science, complete junk. I'll give you an example of how junk it is. First of all, the theory of cloth masking originated from the droplet and fomite theory. The idea was your big gobby droplets that form fomites will be stopped by masks. When it was understood that droplets and fomites were not the mechanism of transmission and that it was aerosols, they should then have said, okay, masks can't possibly work. But they continued trying to do studies demonstrating that droplets of a certain size were caught by masks and claiming that that was of some kind of beneficial value. But it's not, because how do you generate in an industrial setting an aerosol? What you do is you wet a membrane and you pass air over it. and then it causes the large droplets of water to become aerosolized, nebulized. So what's happening with your cloth mask? The small proportion of droplets that come out of when you breathe that are large enough to get caught by the mask go onto the mask. Next time you exhale, you aerosolize those droplets, turning them into the actual vector of transmission. That's why we can't see any effect in the epidemiological time series or on intercountry comparisons. When you look at neighboring counties in America that have one with a mask mandate and one that doesn't have a mask mandate, they have identical pandemic curves, not slightly worse for the mask mandate counties actually, but not by a statistically significant amount. So it's all junk science there, and what we knew before the pandemic is what we should still know now, which is that masking does nothing to prevent the spread of respiratory viruses.
Yeah, me and Nick, this has been such an interesting conversation. Thank you so much for your time. I want to give you one last opportunity if you want to add, plug, or say anything that you want to.
Yeah, I think the thing that I would say to people is, people who hear this kind of thing for the first time say, oh, but what are you saying, that all the world scientists are wrong? No, I'm not saying that. What you've got is a situation where the scientists who object and who dissent from this narrative of these corrupt scientists and corrupt public health institutions are being actively silenced. There is a vast censorship operation has been underway since April of last year. And it consists of fact checkers and social media banning and refusal to publish journal articles that would contradict the cults following science. So there are plenty of scientists who disagree with all of this, but their voices are simply not heard. They're being deliberately silenced. That's point number one. And point number two, I would say to people, if you have been getting your information from mainstream media, it's wrong, and you need to do some research. Otherwise, what happens is people say, oh, but it sounds like a conspiracy theory. What I'm talking about, everything I've spoken about here is completely verifiable. It's completely factual. It sounds like a conspiracy theory to people who haven't heard it before because they haven't heard it before, not because it's false or it's secret. It's not being kept secret. It's out there in the public domain. It's simply not being spoken about in mainstream media. And that's what I think causes people to go, well, but why are they doing this? But are you saying that all the scientists are wrong? Or that's the mistake that people make. You need to engage with these ideas and do your own research. Turn off your televisions and stop consuming mainstream media. They're controlled entities, and they've been lying to you from the very beginning.
Well, thank you, Nick. Yeah, I can really hope that this pandemic, we can end with the politics and get back to the science. But thank you so much for your time. To our viewers, if you've made it this far, you most certainly enjoy the content. Please like, subscribe, and donate on Patreon. My name is Donald, and you've been watching WorldView.